Hi, it's me, Ingridine FP, and this is medical literacy, medical ABCs, where I give unsolicited medical advice. Okay, I do happen to have a medical license, um, so I don't want to give medical advice here on YouTube, but I do want to give medical advice. Uh, no, but I'm just going to give like some tips, some things that I say very often to my patients, and things that I just keep repeating every day, um, and that I think that might be common sense to some people, but that might not be for others. Keep in mind that I am practicing in Sweden, so um, the things I talk about might not apply to your country. But I'm going to be talking about like very basic, very general kind of advice. So the first advice is about painkillers. Okay, so there are different kinds of painkillers, and I often see people saying like, "Oh, I took one Tylenol, or I took one ibuprofene, um, or like I took both, but like at different times." And what I suggest for somebody who is in a lot of pain and who's taking over the counter medicine is paracetamol, which is Tylenol. It's called Alvedon here. It's called paracetamol in other countries. And paracetamol, the highest dosage of that that you can take, that is actually okay to take, is 4 grams a day. So that is usually each Tylenol is 500 milligrams. So it's 2 paracetamols at a time, 4 times a day. So with 6 hours in between. And this is what the orthopedic doctors recommend. They like basically for them taking 1 paracetamol means nothing. You need to take 2 at a time. Now I know that a lot of you guys are not into taking medicines, but in this case, if you're in a lot of pain, start with that. People are worried that paracetamol will hurt their liver, but actually it will not hurt your liver unless you are like have a liver disease. Unless you have a liver disease, you shouldn't be worrying about getting liver problems if you keep yourself to 1 gram of paracetamol or less a day. So don't go over that dosage, because then you're not actually getting more help from it. But I would recommend people going on the maximal dosage if they're still in pain. Then on top of that, you can lay on anti-inflammatory painkillers, where ibuprofene is the one that I use the most. Another one is naproxene. I don't know what they use in the US. There are different kinds of anti-inflammatory. Some of them are not good for your stomach if you take it too often. So if you take it regularly for 1 or 2 weeks, after a certain point, you might start feeling like your stomach lining is getting irritated. So I would advise against taking it too regularly for too long of a period of time, because it can hurt your stomach lining. Especially diklofenak is not recommended. Also, you cannot take any kind of anti-inflammatory medicine like ibuprofene or naproxene or diklofenak if you are on anticoagulant medicine, because these anti-inflammatory medicines also make the blood thinner. So if you are on the baby aspirin or acetylsalicylic acid, as the name actually is, for whatever reason, because of blood clots or that kind of thing, you cannot take ibuprofene or anything of the sort. Paracetamol, there is no problem taking that, but there is a problem taking these anti-inflammatory if you are on these medications. So that's the most common kinds of medication. There is also a pain medication that is in cream form, and that is completely okay to take even if you have arm blood thinners, because it does not go into your blood system. So having anti-inflammatory creams, if you like your knee hurts and you use that, then that is completely okay. So that is about those things. What is the next step of pain medication? It is morphine. And we want to keep away from morphine as much as possible because, or codeine or all these opiates, because, well, there's a risk of being addicted to this. Also, it might be problematic for your stomach. You might get problems with constipation. You might also feel really drowsy. So I would not recommend that unless you have spoken to your doctor and they say that it's okay. Stay on the lowest dosage of that, and make sure that you have a continual discussion with your doctor about that. So I only do that if I've tried everything else. Other kinds of pain medication is cortisone injections if you have arthritis in your in your knees or in different kinds of joints. That's something that your doctor can give you in a shot. It needs to be sterile and done by a medical professional. And it's not always something that works, and it only works for 3 months max at a time. And sometimes it does not actually go right in, and sometimes it's just a matter of luck if the doctor manages to get it right or not. Obviously, there is also a question of skill, but sometimes it's just a question of luck. So I only do this in certain cases. But it usually helps quite a lot when it comes to arthrosis, because we want to avoid being operated on. So that's another pain medication. That cortisone stays in the joint, so it doesn't go into the rest of the body. So you don't need to be worried about side effects of cortisone in that case. Side effects of cortisone are pretty big. Certain diseases that do give pain, rheumatological diseases, are treated with tablets of cortisone, and there you need to talk to a rheumatologist about taking cortisone, because it can give a lot of problems if you take it for too long of a period of time. It can give you, it can make you have osteoporosis in your bones. It can make you really alert and have problems sleeping. It can give you nightmares. It can also give problems with your stomach lining again. And generally it can also make your hormones unbalanced, and you could also make your immune system kind of shitty. So talk to your doctor before you take cortisone. Some people take cortisone for other reasons, like asthma or that kind of thing. That's something I'll get to later. But we're talking about pain medications. Another thing is that when you take morphine, you often get constipated. So, like, if you have problems with that, like, ask your doctor about different medication for that is available. So we've talked about different pain medications. There are other kinds of pain medications for different kinds of pain. So the kind of pain that I've been talking about mostly is called nociceptive pain. It's pain that is related to like physical facts, like physical pain in your muscles, pain in your bones, pain in your joints, pain because of a trauma, physical trauma, pain in your stomach, pain in all these kinds of pain. But when it comes to nerve pain is often radiating pain, pain that is more like small needles or like disturbance in your feeling sensation. So it might be burning, it might be the different kinds. Doctors can prescribe neuropathic painkillers. There are different sorts. The problem with them, so there's gabapentin, there is amitriptyline. This is a little bit like stronger stuff that makes you tired because it makes your nerve system kind of low. So, but those can be really good. For example, if you have like ischias nerve problems, or if you have problems with like carpal tunnel problems, problems that have to do with like the nerves that go down to your legs and your arms. They can also be good for certain kinds of headaches. Migraines have specific kinds of, they have triptans for migraines, and that is something that you should talk to your doctor about if you have migraines. So that's all about pain medication. Now let's go to allergies. Allergies, there are many different kinds of allergies. There are allergies to different, like there's allergies to stuff in the air, there's allergies to food, there's allergies to animals, allergies to, well, different things. There are blood tests that you can take. There are also skin based tests that you can take at your doctor's office if you suspect that you have an allergy. It's always good to get tested about that. The different components of allergy treatment is antihistamines, which are tablets that you take that like kind of lower your immune response to these things that shouldn't be triggering your immune response. So that is something that like you take every day if you have problems with pollen, for example, hay fever. They do make you tired, but well, a side effect of having hay fever is being tired. Another thing is your nose gets clogged. Nose spray that has cortisone in it is good. So here in Sweden we use something called Nasonex, but there are many different kinds of nose sprays out there. And that is something that you can take morning and evening. And then when it comes to your eyes, if your eyes are scratchy and watery, there are different allergy eye drops to use for your eyes. If you have pollen allergy, a good tip is to go like air out you know, not to have the window open when you're at home. When you come home, take a shower so that you can like get away all of the pollen from your body, um, and um, and then take the medication for that. It's not like dangerous to take medicine for that. But yeah, certain people just want to suffer. So uh, a lot of people come to me and are worried about that medication, but it's like it's been well studied. It works. Um, don't worry that much. Um, so that's about allergy medicines. Um, and I've been thinking of like doing a series about a little bit of medical tips. Um, Obviously, take this with a grain of salt because I'm not your doctor. I'm just a doctor out of many. This is just things that I say to a lot of my patients when they come in. It is obviously like based on Swedish norms and not on American standards or standards for any other country. I'm not sure of which medications are available in your country. So yeah, take this with a grain of salt, but I hope that I can help you guys a little bit in navigating the medical world without having to Google a bunch of crazy shit. Okay? So have a great day, everybody. Bye.